Welcome to Adapting Class. Guess what? Your patient is in labor and delivery, and you are the nurse. Which medication could stop contraction? Which one could cause harm to the patient? Let's run through rare and clear start kind of question, pharmacology or maternity that you definitely have to be aware of, have to know a little bit about it. If you want more content about it, I will link that video to it. But this is a NCLEX practice question on maternity pharmacology, NCLEX review question. Let's get to it. 10 question, content mastering on maternity pharmacology. As usual, you know that NCLEX. You got to read the question from the back, figure out the content, and use your content to answer the question by finding what? Your buzzword. What is the question asking? Which finding requires the nurse to take immediate action. Prioritization 101. Immediate. Change everything. That means all of this may be right, but you need one information that is wrong. The nurse is caring for a client in active labor. Keyword here, buzzword. Who is receiving what? Pitocin, Oxytocin, infusion. Which of these information will make you intervene immediately? Step back. Don't pick an answer. Focus on the buzzword that I've underlined. And that buzzword is Pitocin. If a patient is receiving Pitocin, there's certain content you have to know. You have to know the number of contraction you need to have in 10 minutes. You have to know the frequency of the contraction. You have to know the amount in 10 minutes, and you have to know the tone and of the contraction and the duration of each contraction. This is what the question is asking. It's not something new you don't know. I know you know because you watch Adapting Place. And like you said, if you want the key medication where I discuss everything, I will link into this video. Check the description and you will find it or in the comment section. So contraction every 3 minutes lasting 60 seconds, that is good. You need what? At least from one contraction to another, you need at least 2 minutes. Well, every 3 minutes is good. And you don't want one contraction to last more than 90 seconds. It's lasting 60 seconds. I don't need to do anything. Fetal heart rate of 150 beats per minute with moderate variability. That is a normal rhythm, right? When the baby has a moderate variability, is good. And his heart rate will run, he or she will run between 110 and 160. So this is good. The resting tone of the uterus when it's not contracting, 25 is good. 85 is the max. Above that, we have a problem. Therefore, just by elimination, number 4 is wrong. Contraction that lasts more than 90 seconds is not good. And there is no rest in between. That means the 2 minutes that you have to rest before you contract is not there. Therefore, the right answer, number 4. This is Adapting Class. If you're hearing my voice for the first time, thank you for watching. But these are content we will be reviewing as we do the question, maternity pharmacology using NCLEX review questions. And so check the description, like I said, for content related to these questions. A nurse is caring for a client receiving what? Magnesium sulfate is coming, whether you like it or not. NCLEX is going to ask you about maternity question. And these are the pharmacology. There are few pharmacology you're supposed to know. Maternity's magnesium sulfate, right? For severe preeclampsia. Which assessment finding require immediate intervention? The key word is what? Patients as what? Preeclampsia. And we want to prevent seizures. So we put them on magnesium sulfate. Which information will let you intervene? You got to go with your content and the buzzword. The magnesium sulfate is a downer. It depresses your central nervous system. It depresses everything that you have, your cardiac, your respiratory, your lung, your urine output, your brain. Basically, everything is going down. But how low do you want it to go? Is the key for the NCLEX, right? You have to know certain things. If your urine output is less than what, 25 is a problem. 30 is not bad. If you don't have reflexes, it's a problem. I have 1 reflexes. If your respiratory rate is less Then 12 is a problem. This is 10, bad. Magnesium level is a little bit high, but it's acceptable because we give in the patient what? Magnesium sulfate. But what is the problem? Which of this will you pick? They are not normal. They are all the way in the low range, but some of them are not bad. And that is what prioritization is. If you have 1 second, I will deal with the respiratory status than any of this. This is all the way I will be using to answer questions. And that's the way I want you to think. I know you know this one because you watch adapting class, right? If you don't watch it, I want you to continue to watch it and you see content-based answering questions. Should the nurse report to the provider immediately? What is that? Which assessment finding is in a client receiving terbutaline for preterm labor should the nurse report to the provider immediately? Step back, go with the content like I told you. Content is what? Terbutaline. You know what kind of medication is used for. I've given it to you. Preterm labor. Which of these findings should you worry? So if I give you terbutaline for preterm labor, which of this should you worry about? Look at it. Is it your blood glucose of 130, your maternal heart rate of 120, and a fetal 122, fetal heart rate of 150, and complaint of jitteriness, right? What do you think? 10 seconds, pick an answer. You know the content. I want you to focus on terbutaline and find out what it is, right? You know it. I want you to recall it right now. Recall it. Terbutaline is a beta agonist. I'm giving you a clue. If I give you a beta agonist, that means everything goes up. Therefore, look at the things and see if everything is going up and which one you don't want it to go up too much. You already pick an answer. I know you picked the right answer. Which one was it? Well, blood glucose of 130. It's not that bad. But beta agonist will make your glucose go up so that it can give you energy. See, like sympathetic nervous system. Maternal heart rate greater than 120 is too much. I mean, your heart rate of 122 is bad. Fetal heart rate of 150 is really normal in me. And you get palpitation. It's like I give you Epidural. Terbutaline, you can use the same medication in asthma patient. So I give you terbutaline, you're going to have palpitation, you're going to have anxiety, you're going to have jitteriness, right? But between all of them, 2 is bad. So maternal heart rate is greater than 120 is too extreme. I'm giving you concept you can use to answer any maternal pharmacology using these NCLEX review questions. And if you want to watch it multiple times. I want you to take note and also watch the video linked to this. A client is scheduled for labor induction with what? Intravaginal misoprostol. I don't like to give you a lot of information in the question, straightforward like an NCLEX style, so that you can focus on the buzzword. Which client history should the nurse report to the healthcare provider before administering the medication? Rewrite it on your own words. I'm giving you intravaginal misoprostol. You know what it is, right? You know it. Which of these findings will make you worry in the history? This is one medication. Before we give it to you, we got to take certain history. Is it because you had 3 babies before or 3 pregnancy? And you have 2 babies and now you're pregnant again? Or is it because you have previous C-section? Or because you have gestational hypertension? Or because you dilated 1 centimeter, 30% effaced? That's the latent state, right? Which one will make me worry? I want you to step back and look at the situation. The lady is in labor. If I'm giving you a medication because you're in labor, most of the time, probably I'm trying to augment your contraction, ripening the cervix to induce labor, or you're bleeding and I'm stopping your bleeding, or you need pain medication and I'm giving you pain. This is all about pharmacology in maternal health. If you know these 3 things, you say, oh, are they giving it because you're bleeding? Are they giving it because I want to induce labor? If I'm inducing labor, this medication is used to induce labor, misoprostol, like, right? It can cause abortion. It can cause contraction. It's like Pitocin. And one of the contraindication is what? you should never have uterine surgery, especially classical one, like the T. The classical one is like, if this is your uterus, right, they will cut you like that. So thus, it can break, it can cause rupture easily. Just because you have 3 babies, 3 pregnancies doesn't prevent that. But if you had 2 C-sections, it's bad. So a previous C-section is a problem. So that's number 2. Number 2 is the right answer. Number 5, which action should the nurse take first? A client in labor receive what? IV Nalbuphine for pain and soon become lethargic with minimal respiratory effort. The way NCLEX asks you questions, they give you the medication and they can give you the reason why we're using it so that you don't have to memorize it. Or they can give you the medication, you got to figure out why it's being used. Or they will give you the medication, they want you to figure out what is the major side effect. I've given you the medication, Nalbuphine, and I want you to know that the patient is having respiratory distress, or it's lethargic and respiratory effort is minimum. That means I'm having side effect about that medication. What would you do? If you don't know what Nalbuphine is, I've given you a clue. Lethargic, respiratory effort. If somebody is having lethargic and respiratory effort issue, what medication will you give them? IV fluid? Let the provider know, intubate the patient, or give them naloxone. What do you think? 10 seconds. Pick an answer. Write it down. Stop the video. See the way I'm going to approach it. I've given you half of the clue already, so you should know it by now. But then, what do you think? Nalbuphine is one of the pain medication. It's an opiate, I've told you. So it's a form of opiate. It's an antagonist or an agonist. So both of it, either 50-50 of it. That's why it's very good. If I give you opiate, well, it causes respiratory distress, right? Suppression. Your respiratory status may go down. What you use to reverse opiate is not IV fluid. It's not calling the doctor. It's not intubating the patient. It's by giving the patient naloxone. Anybody giving opiate, you have naloxone with it. Even outpatient medication, nowadays we're giving you naloxone. So the right answer is number 4. You can see, I know you're mastering the questions. Once again, stop the video, answer it, and see the way I approach it. Which finding required the nurse to hold the medication? That means something is not right. The nurse is preparing to administer what? Methylergonovine. I pick all the OB medication NCLEX has to ask you if they're going to ask you the medication. Not esoteric one, but this is the most friendly, the most common, the most tested maternity pharmacology. And one of them is Methylergonovine. You have to know this medication, whether you like it or not. It should be your friend today by listening to me. To the client with what? Postpartum hemorrhage. Keywords. If I give you medication because you're bleeding, that means it's going to cause constriction. It's going to make the uterus contract and make it smaller so that you stop bleeding or prevent blood from going to the uterus. Like the way I taught you how pharmacology work. I give you the medication and what is going to be used for. Postpartum hemorrhage is because it causes vasoconstriction, which finding required the nurse to hold the medication. Is prioritization 101. Always think about how the medication works. And if there's any contraindication to that medication, then that's your priority, not the common side effect, things that will kill the patient. Hemoglobin of 10.2, where the patient is bleeding. Blood pressure of that, 162/94. The medication causes vasoconstriction. Think about it. Uterus fundus firm and the umbilicus, that is what? Bogginess. That means it's too high. It's supposed to come down. It's not coming down. That's why the patient is bleeding. Client report nausea. Well, it should not prevent me from giving you Methylergonovine. The key word is this medication causes vasoconstriction. Therefore, if you have any medical condition that vasoconstriction is going to worsen it, patient should not receive it. Hypertension, stroke, coronary disease. 3 things you should never forget when you hear about Methylergonovine. Therefore, the right answer is number 2. Which the nurse is caring for a laboring client who recently received epidural. Which assessment is the priority? I want you to learn how I answer question, test-taking strategy, and show you the keyword. You don't have to even look at the answer. When you read the question and you look at the answer, you're wasting time. You losing key points. You losing the analysis of the question. Who patient had epidural? What is your priority? Step back. Ask yourself, what is the buzzword? Epidural. What is used for? For pain. Where do we put it? In the epidural space. What effect is going to have on you? Maxed your sympathetic nervous system in that level, and therefore you have what? Hypotension. That's all. Therefore, what should be your priority? Look for hypotension. At the same time, in order to prevent that, mommy has to have fluid on board. Therefore, which assessment is your priority? Not because of the position of the baby, not because of the mommy temperature, not because of cervical dilation, because of your blood pressure. So I'm checking your blood pressure, number 3. Which medication should the nurse anticipate administering to promote fetal lung maturity? This question is about the lung. That's all. And nurse is reviewing medication for a client at 30 weeks gestation preterm labor. Preterm less than 36 weeks. And I want to protect the lung. It's a content. Like I said, watch the video. I'll be linking into this. You talk about all the pharmacology in detail. Preterm labor, that means you less than 36 weeks contracting. If you less than 36 weeks, then I need to stop the contraction. Terbutaline will stop contraction. Endomethacin stop contraction. Nalbuphine stop contraction. The only thing that matures your lung is that. I put it here so that you can know these are medications we can use for preterm labor. Calcium channel blocker, NSAIDs, and then beta agonist, terbutaline. So betamethasone is a steroid that we'll use to improve your lung function in the baby. Number 9, which client history should the nurse report before administering? That means contraindication to the medication. A nurse is experiencing uterine atony unresponsive to Pitocin. That means the uterus is boggy, big, it's not contracting, right? We're giving the mother different medication. The provider prescribed Carboprost, right? Carboprost. Which client history should the nurse report before administering, right? Pay attention. It's a Carboprost. It's another medication. If you never know about it, I'll give you the content. One of the contraindications for this medication, not because you have diabetes, not because you have multiparity or preeclampsia, is because it causes bronchospasm. That is the major side effect. Therefore, if you have asthma, a bad combination. So Carboprost in a patient who has asthma is a big problem. And the last question, I know you get it. It's not that difficult. We've seen this medication before. It's straightforward. You got it. I know you're watching it. I know you can answer this. Put down your answer. Stop the video and then listen to me. Which assessment is the most important before administering the medication? And nurse is administering Nalbuphine, right, to a client in active labor at 7 centimeter dilated. Nalbuphine, we've seen it, is an opiate, right? Which assessment finding is most important? That's all. It's an opiate, agonist and antagonist. I'm giving it to you because you need pain. So your pain score is fine, but it shouldn't be my priority, right? Maternal, I know you're already in pain. That's why I'm bringing the medication. So if you're pain 10 out of 10, I don't need to assess it anymore. I need to see what your respiratory status is. If it's already low, if I give it to you, it's going to drop. Your duration of contraction, well, this has nothing to do with it. Yes, duration of contraction deal with Pitocin, how long you contracting. This is also related to contraction, right? If I have to give it to you, I have to know the peak of your contraction, right? At the peak of contraction, that's when I can give it to you so that it does not affect the baby. But it's still okay. Time of the last meal. Well, it's too late. So we have 1, 2, 3. The most important is the mommy respiratory status. If it's low, we have problem. So that's the most important one I have to worry about. 10 questions, maternity pharmacology, NCLEX review question, NCLEX practice question for nursing exams. I know you got it. If you need more, like I said, check the video that is linked. Talk about maternity pharmacology, maternal health pharmacology, and all the things that you know, the detail, the risk factors, and everything. Thank you for watching. If you like this video, share, subscribe to our Dr. NCLEX, join our membership, and good luck in your exams. Bye.